Welcome to the Citizen TV News Brief. I'm Victoria Rubadiri, our sign language interpreter. This afternoon is Yula Nzale. To our top story, one more person has died to raise the COVID-19 death toll to 10 in the country. 9 more cases have been confirmed. Here now is an excerpt from today's update by the Health CS Mutai Kagwe.
In the last 24 hours, we have upped our testing capacity, as I mentioned, and tested for the first time over 800 samples, and hopefully we can begin to double even that number. But during that period, out of the 803 samples, 9 people have tested positive, bringing to 225 the number of confirmed cases in the country. And I would like also to mention that all the 9 cases are Kenyan nationals. And also, none of them has a history of travel, and none of them was in a quarantine center. These are people that we have tracked through contact tracing and also testing people who come to us because they are feeling unwell. And out of those 9 cases, 5 of them are from Nairobi and 4 of them from Mombasa. They are aged between 9 and 69 years old.
And 21 people in mandatory quarantine at the Kenyatta University Center have held protests this morning on their continued stay at the quarantine facility, even with 2 COVID-19 tests that have turned negative. They marched towards the main entrance of the university, claiming the government has been silent on their issue. They are questioning the criteria used by the Ministry of Health to discharge 4 people who were quarantined with them while leaving others. They claim they have stayed at the facility for 23 days now and have exhausted their resources. Several police officers were deployed and forced them back into the facility.
We have been tested twice. Guys are negative. You guys, we don't know your status, so kindly can't do. Hi guys.
After testing negative twice, we should be released to rejoin our families immediately. A reference to W.H.O guidelines on quarantine should apply. We fail to understand what else the government wants us to do and what informs our continued forced detention here. Since the results of the second negative results, the center management has since selectively discharged 4 people and left the rest of us at the center. We do not understand the basis of which the ministry used to discharge the 4 people, or does the government have double standards for discharge from quarantine facilities? We demand that the same standards used to discharge our colleagues be applied to the rest of us. We do not have the means to pay for the cost of quarantine at the facility. We are therefore unable to continue staying in these facilities. Self-quarantine and home should be used for the people that have posted negative results for both tests. We no longer feel safe at the quarantine centers, as they now appear as breeding grounds for COVID-19.
Now, Ngara Health Facility is on the verge of being shut down if health workers whose tests were taken today turn positive. About 60 health workers who have been in mandatory quarantine for the last 16 days after one clinician from the facility was confirmed to have tested positive for the novel coronavirus were tested today. The test, whose results are expected in the next 24 hours, will determine if the facility will be closed indefinitely or will be given a clean bill of health to continue with its operations. The government has ruled out mass evacuation of Kenyans living abroad, pushing for their return from COVID-19 ravaged countries. Well, Foreign Affairs Principal Secretary Ambassador Macharia Kamau says there were over 3 million Kenyans living in the diaspora, and it would not be tenable in terms of costs and logistics to evacuate them. The PS was, however, taken to task by committee members on the mistreatment of Kenyans in China and the government's apparent indifference to their suffering.
But practically, because telling us just to send planes, haiwezekani. Ndege inabeba watu 200 na ikienda Hungary sio ati huko itakuta 12. Then from there it cannot begin jumping around picking up sio matatu. You see, this is a serious problem. So I'm asking you to look at those issues for us. And the time that we did offer, there were 3 places where we offered, where we had the clamor. Dubai, DRC, and South Sudan. And when the moment arrived and we said the plane is available, in fact, we were getting a plane, it was coming to pick up people from the United Arab Emirates here. So Emirates was coming. Tukasema na Emirates, tubebe watu wetu. Wakakubali. When they were told to pay, I think 13 took up the offer. But when they were on social media, there was 200, 300 of them screaming, evacuate us. But when the moment arrived, 13 came to the plane. Ndege kubwa, 777. 13 came. We talk about China. Hiyo ni kelele ya vijana nawaambia, ambao wamekosa kufuata harakati za serikali ya China. Kusema ukweli. Tumesema tuseme ukweli. Lakini India, wagonjwa, watu wa rika letu wengi wanatibiwa makansa, magonjwa kama hayo. Wengine washatibiwa sasa they are dying not because they are not well or they have not been treated, but because they are now stuck. How do you recuperate under those circumstances? No. So before we clamor for these young men and women in China, ambao wanapigia ma-MP wao masimu, wanaingia kwa social media, wanajitetea, let's ask ourselves about those who are suffering in hospitals and in recuperation homes in different parts of India. Ujue India ni kubwa. Wengine wako Bangalore, wengine Delhi, wengine Bombay. So they're all over the place.
And the Council of Governors has raised concern over the frustrations county governments are facing in procurement of medical supplies from the Kenya Medical Supplies Authority, or KEMSA. According to the council's chairman, Wycliffe Oparanya, the situation is frustrating their efforts in their fight against COVID-19. Additionally, the COG received essential items from the county pension fund worth 2.3 million shillings that is to be distributed to 10 counties in the country to help in the fight against COVID-19.
We therefore urge the Ministry of Health and Parliament to urgently review or suspend the law to allow county government to procure essential medical supplies requirements from other suppliers. We are using very established OTT firms like Ernst & Young, Pricewaterhouse, who will monitor to ensure that when funds we start distributing, these funds will go to other intended purposes.
Inspector General of Police Hilary Mtambai says the law enforcers will start enforcing the government directive on wearing masks in public places. The police IG was speaking in Mombasa, where he is on a tour to monitor enforcement of government orders on restriction of movement in Mombasa, Kilifi and Kwale.
It is compulsory to put the face mask. This is through the Gazette notice dated 6th of this month of April, which was issued by the Office of Attorney General, directing that all people should put on the face mask. These attracts, failure to that, these attracts a stiff fine of 20,000 or imprisonment of 6 months or both if you fail to comply. And I've instructed the police officers to enforce this. And I am calling the members of public, we observe the face mask. We are working with the human face, but it is for the good of the people to use face masks. It is not for the good of the police. It's the good for the people.
And on the international front, U.S. President Donald Trump has halted his government's funding of the World Health Organization, accusing it of mishandling the coronavirus global pandemic. Trump has of late consistently accused WHO of failing to take early precautions when the coronavirus outbreak was reported, now saying the financing has been halted to allow time to review WHO's conduct. Now, the U.S. supports WHO operations with more than 40 billion shillings annually, the highest contribution from any country to the UN health body's 2-year budget of nearly 500 billion shillings. Trump's decision could hurt WHO's efforts to slow down new infections.
To halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
And back here at home, police have begun a search for Ken Walibora's missing car after the renowned author and journalist was killed on Friday last week. Central OCPD Mark Wanjala confirmed that Walibora was hit and killed by a bus along Landis Road on Friday morning. The Mercedes-Benz key, which was found in the crime scene, was used to trace the identity of the late author. His body was preserved at the Kenyatta National Hospital Farewell Home, where he died while recovering or receiving treatment.
Aligongwa, hakuwa na document, lakini kifunguo ya gari ndiyo ilipatikana hapo kwa scene, gari aina ya Mercedes-Benz. So far hatujui gari lake liko wapi, lakini mwili ndiyo imepatikana huko. Hata vile alikuja huko Landis Road ya cross barabara kwa mguu, ndio hatujui alifikaje huko. Hiyo bado inafanya uchunguzi.
Na alikuwa bado anaendelea kuchangia. Hilo la kuendelea kuchangia ndio tunafanya tunalia, maana huu ni mchango ambao tutaukosa. Maana ashaondoka na talanta yake ambayo haiwezi kurithika. Hakika tumempoteza sana.
Mwaka 86 Kenya ameanza kunikuza katika uandishi wangu. Na mpaka kanilea nilipofika nimefika sasa, nimeandika miswada mingi na vitabu viwili vya ushairi. Na bado tunaendelea kuandika. Tulikuwa na azima ya kutoa kitabu cha 3, lakini habari ndio hii, Mwenyezi Mungu amehitari roho yake.
A devastating blow to the media fraternity. He will indeed be missed. And to some sports news now. 2017 London Marathon winner Daniel Wanjiru is the latest Kenyan to be suspended by the Athletics Integrity Unit, or AIU, for doping violations under the World Athletics anti-doping rules. Wanjiru remains provisionally banned after the AIU found a violation on his athlete biological passport, which electronically monitors athletes' selected biological variables over time. Wanjiru rose to the limelight in 2017 when he shot to victory in a strong London Marathon field by beating Ethiopia's Kenenisa Bekele. The Kenyan finished a distant 8th in the English capital in 2018 before dropping further to 11th at the 2019 race owing to multiple injuries and dipping form. Wanjiru joins a list of around 60 Kenyan athletes who have been sanctioned for anti-doping rule violations in the past 5 years, as he awaits a hearing of the allegation to take place.
Now, if you'd like to turn for this group.
Russia's anti-doping agency will undertake a broad program to monitor athletes' biological components once a full hiatus in testing linked to coronavirus containment measures across the country ends. Moscow and several other regions have declared lockdowns to stem the spread of the new coronavirus, which has so far infected over 24,400 people across Russia. Other countries, including Canada, have also temporarily put testing programs on hold during the pandemic. RUSADA was suspended in 2015 after the World Anti-Doping Agency found evidence of mass doping in Russian athletics. The agency was conditionally reinstated in September 2018. All right, and that's the very latest from the Citizen TV newsroom at this hour. Thanks for watching. I'm Victoria Rubadiri, and our sign language interpreter for this broadcast was Yula Zale.